Hi everyone, this is Dr. Stefan. Welcome to another video. In this one, is exercise advisable when you have sarcoidosis? So a bit of a niche question that I received, but I think it applies to many other conditions as well. So if you are struggling with another respiratory condition, for example, or maybe a heart condition or something like that, it may be interesting for you. So first of all, sarcoidosis is a condition that is associated with inflammation. It can affect different organs of the body. It mostly affects the lungs. That's why generally pulmonologists end up diagnosing sarcoidosis, but it can also affect the skin. In some cases, it can affect the heart, the nervous system, lymph nodes, liver, etc. So it's a condition that can lead to inflammation in different organs of the body. Depending on how the sarcoidosis behaves, it can progressively worsen, or in some cases, it can just disappear on its own without treatment. Sometimes a little bit of treatment is required, but generally that's when there is a complication or when the body is affected in such a way that we anticipate vital organs becoming damaged due to this inflammation, or when the symptoms are just unbearable. So this is just the gist of sarcoidosis. Now, with exercise, I would say in most conditions, unless your doctor has told you otherwise that you shouldn't exercise for a specific reason, in most situations, I think most people will do much better if they exercise a little bit. Now, with sarcoidosis, I would say probably if you have heart involvement, cardiac sarcoidosis, that's when you need to maybe have a very honest discussion with your doctor about what you can and cannot do and how the sarcoidosis is affecting your heart. Because I would say that the main thing would be if you are having heart rhythm disturbances related to the sarcoidosis involving the heart. That's when you may, for example, during very, very intense physical exercise, if you may get some kind of a heart rhythm disturbance. That could be one thing where I would say to be a bit more cautious. But otherwise, if you are exercising moderately just to maintain fitness, to break these vicious cycles in which all of us can get into, to become deconditioned because we are a little bit breathless, maybe because of our condition, so we end up doing less and less. Our body interprets this as well. We don't need to maintain strength in respiratory muscles anymore because the life is like this now. So in those situations, probably pushing ourselves a little bit to the point where we become a bit breathless, then we stop, and then we do a bit more, we become breathless again due to the exercise. We go back to resting a little bit. Just training in this way may actually help us improve our symptoms. And sometimes the beauty of exercise, and that's why it's becoming so popular these days to do exercise despite having illnesses, is because it improves your mental well-being. It tends to regulate the body's metabolisms. You tend to eat better when you exercise because you're trying to maintain your fitness. So a lot of things change holistically when we exercise. And I would say that there's overall more benefit to exercising than not doing it. Unless there is a severe risk to health that your doctor has advised you on, I'd probably say that doing a little bit of exercise is fantastic for most conditions, including sarcoidosis. And you don't need to start with something dramatic. You don't need to go to the gym. This is where people, I think, get it wrong when they think about exercise. They think that they need to spend a lot of money going to the gym. I don't think that's true. So the easiest thing you can do is go for a walk. This is the easiest thing that you can do as a form of exercise. Or even if you cannot walk because of different other conditions, for example, you've got severe joint disease, you have pain, you cannot do anything, even just getting up from your chair a few times every day, just getting up from your sofa, moving around the house for a bit, sitting down. Even that is a good starting point. So you need to see where your baseline is, what makes you breathless, what makes you puff a little bit, make you pant a little bit. And just do that for a bit. When you get too tired, have a break. Start again and keep going. Keep doing this. Keep pushing yourself a little bit because it tends to get better over time. And it's fantastic because at some point when you do exercise, you notice the gains. So you may not notice them from day to day, but if you do it in a sustained way, you keep pushing yourself every day, probably a month later, if you keep a journal or if you think back where you were a month before, you may find out that despite your condition, you're suddenly able to walk a bit further, to do a little bit more, to find it easier to move around the house, to get out from your chair, from your bed. So things like that can help. So I would say starting exercise is probably the easiest and the hardest thing at the same time, because it's easy that you can do exercise in a number of ways. You can be as creative as you want. You can go for walks, you can go running, you can go to the gym, you can go swimming, you can go cycling, you can even do a little bit more work around the house or in your workplace. All of these things can count as exercise. You can take the stairs instead of the elevator, you know, just things like that. Always, you can park your car further away from the shop and just walk a little bit more. So all of these things can be forms of exercise. It doesn't have to be a certain program. You don't need to follow a certain guru online. You can just adapt the exercise to your own situation. And I think if we all did a little bit more, we would find that we learn more about ourselves, about our bodies, and how much we can do. And it may be shocking sometimes when you have an illness that to realize that you were able to do so much before, and suddenly you need to establish a new baseline and to accept the fact that, well, now I cannot do what I was doing 3 years ago. But that's fine. That's okay. That's where you are now. And we can only live in the present and think about the future. And if we think about it long term, if our exercise ability is declining like this, we need to see what can we do to stop that process. And in some cases, it is the condition worsening, but in many situations, to be honest, it's also the fact that we become a little bit depressed by the fact that we have these conditions. We tend to do less and less. We lose joy. We lose the interest, the motivation, the drive to do exercise. So if we start slowly to build up our confidence, I think we would all feel a little bit better. And that's valid for those of us who maybe don't have a condition, and also for the ones who have certain illnesses. It's just important to be very, very honest with yourself where you are and what you can do to improve that. Hopefully this was helpful and a bit of an encouragement. And I would really, really urge you to go speak to your doctor about exercise programs, pulmonary rehabilitation, seeing physiotherapists, what you can do to incorporate exercise as part of your management and as part of your treatment plan. Hopefully this was helpful. I wish you all the best and good health.